Hello guys, this is Pawan Kumar, currently pursuing BE in Electronics and Communication Engineering in Sri Venkateswara College of Engineering, and today I am here to discuss about my presentation, that is a three-tier approach for lightweight data security of body area networks in e-health applications. And coming to the contents of the topic is introduction, objectives, literature review, methodology, advantages, disadvantages and applications, conclusion, finally the references. And coming to the introduction of today's topic, the demand for advanced healthcare applications is expected to grow with the progressive development of the Internet of Things, including remote patient monitoring, which has become a reality to continuously track vital sign data. That is, for example, blood pressure, blood oxygen levels, heart rate, etc., from individuals. Then, collected information could be accessed by an authorized healthcare provider to enable, for example, the timely detection of clinical deterioration. In this context, a prominent enabling technology in the IoT ecosystem to monitor patients' vital sign data is the wireless body area network. In e-health applications, a WBN aims to provide an efficient and reliable communication infrastructure to all implanted, non-implanted, and wearable sensor devices for the human body. The provision of security services over the entire data life cycle in a WPAN is of paramount importance to prevent attacks such as tampering, falsification, or data capture by a third party. The development of security and privacy services for IoT healthcare architectures is an important research area. On the other hand, the design of computational and energy efficient security machines is essential because WBAN sensors are resource constructed. And coming to the objectives, to introduce an optimal flow control that can handle packet retransmission, collision and contamination to build a reliable network, to develop a hybrid cooperative protocol to integrate the self-organization that will address the scalable networking, and to design simulation environment for performance analysis and evaluation of the results, and to design and implement the proposed three-tier approach for lightweight data security in BANs, and many more, like to evaluate the performance of the proposed approach in terms of security, communication, overhead, and energy consumption. And coming to the literature survey, have referred to the four papers. That is the first one, M. Kumar and S. Chand, a lightweight load assistant identity-based autonomous automation and key agreement protocol for secure wireless body area network from IEEE. And the contribution of this paper presents a systematic survey of the field of ensuring the wireless exchange of information is the initially shared awareness between source and destination. So various encryption techniques are used in literature to, to secure the data. And the second paper is from November 2021. T. Van, L. Wang, W. Leo and SU, a lightweight continuous automation scheme for medical wireless body area networks. And the contribution of this paper is advances in medical science and technology have brought together modern patient monitoring system PMS activated by the wireless body area network, which provides a simple, effective and unparalleled revolution health facilities. WBN used nano sensors to collect patient data and transmit it on the way to hospital server through a wireless network. Privacy and protection of data is an important concern for the patients and doctors. And coming to the third paper, it is from March 2020. A Bandar Al-Zarani and some other professors, a, a probably secure and lightweight patient healthcare automation protocol in wireless body area networks. And this paper contributes A systematic survey of the field used a hybrid variable sensor network system to upgrade the health safety of workers in the construction industry. There are mainly two networks are proposed in the paper to make system hybrid. One is local environment LPWAN and WBAN, second cloud connecting IoT network. And coming to the fourth paper, it is from Feb 2022, lightweight grained access control of wireless body area networks, and the professors M. Ali. And this paper contributes suggests a new approach to data protection, especially during emergencies in a wireless network. WBN uses passive encryption standard 128 cipher requiring considerable time for encryption, which can be fatal in emergencies due to the region and resource constraints. The sensor node protection mechanism should be lightweight. These are the four papers I have taken. And coming to the methodology of this today's topic, we have designed and implemented a healthcare monitoring system for cardiac patients to monitor significant body parameters of patient inside hospital as well as in home. Different sensors are attached or induced to the patient's body to collect vital body parameters like temperature, SpO2, heart rate, pulse rate, etc. and to be monitored. Heart rate and ECG sensor probes are also attached to patients' bodies. And finally, the sensor data is in the form of analog signals and to be converted into digital form using inbuilt circuits of Arduino board which collects and processes sensor data for further communication. For further use and storage, it is then sent to server using suitable wireless communication. And coming to the system model, HA, Healthcare Authority. This entity is responsible for monitoring, for initializing the health system and also generating secret keys of data owners and data users according to their attributes. CSP, Cloud Service Provider. The CSP has almost unlimited computational and storage resources. Its primary responsibility is to provide storage and computational services. When data owners want to encrypt their collected data, they can outsource most of the computational operations of all the encryption phase to the CSP. Moreover, data users can be also use the CSP's computational services. When a data user retrieves an encrypted health data, the CSP can help it to recover the associated data by performing most of the heavy computations of the decryption phase without learning any partial information about the underlying health data. Data owner. Data owner modeling the tiny wireless sensor attached to bodies of patients and employed to monitor the patient's vital physiology parameters such as blood pressure, heart rate, diabetes, asthma, and etc. The health data collected by data owners first is encrypted under an access control policy and then transferred to a smart device. Finally, the health data are outsourced to the CSP for online or offline analyzing and long-term storage. Data user. Data users. Model health service providers such as hospitals, doctors, medical clinics, etc. They can be specified by a set of descriptive attributes. I'm coming to the architecture of the system model, and this is the architecture of the system model. System initialization. The phase is managed by the HA. In this phase, the HA generates the public parameters and the master secret key of the system. It publishes the public parameters to the other artists and keeps the master secret key confidential by itself. Key delegation. This phase is operated by the HA, Healthcare Authority. In this phase, public key and secret key of data owners as well as secret keys of data users associated with their attributes are issued. Each data owner should ask the HA to generate its public key and secret key. Data inscription. This phase is executed by data owners and the CSP. When a data owner wants to outsource its collected health data to the CSP to provide confidentiality and access control, it should define an access control policy and encrypt the health data under it. However, as the computational power of the data owner implanted unwearable sensors is assumed to be limited, the heavy computational operations should be offloaded into the CSP. Description: this phase is managed by the CSP and data users. When a data user is authorized for accessing an outsourced health data using its secret key obtained in the key delegation phase, it can make a description query to the CSP. And this is the workflow of the data collected from the data owner and given to the data user. Coming to the advantages of the today's topic, used for detection of chronic diseases, used in military for security purpose, assist the communication between individual and machine. Emergency services can be got from the doctor. Disadvantages: wired network restriction between the body movement, battery life, lack of integration sensors, non-existent support for massive data. Coming to the applications of this today topic, we classify these applications into two broad categories, that is medical and non-medical applications. Medical applications, a number of sensors are attached to the body like ECG, pulse oximeter, and heartbeat sensor on the patient's body. These sensors used to immediately inform the corresponding medical staff about the irregularities and heart rate in advance. Cancer can be detected by the help of nitric oxide. Sensor is attached to the affected area, which has the ability to detect nitric oxide emitted from the cancer cells. And non-medical applications are heart rate sensors along with some additional sensors can be used to provide information like speed, body temperature, heart rate, oxygen level, timer, and location. WVN can be used to safeguarding the personnel like soldiers and firefighters. Sensors can be placed on their uniforms in the order for them to attend facilities. The WBN sensors can monitor the level of toxics in the air and warn the firefighters or soldiers if a life-threatening level is detected. WBN sensors can also monitor health of the uniformed personnel, especially soldiers who need medical assistance during war. And finally, the conclusion. This paper elaborated the performance and reliability challenges of the WBN systems, the application, and the challenges are briefly discussed. Later on, the need cooperation is emphasized. The proposed cooperation model is discussed and the objective of WBN cooperation are discussed. Subsequently, this article discussed the proposed two solutions to enter the challenging issues of WBN coordinator failure and device mitigation. To overcome these issues, a novel strategy proposed so that the maximum network lifetime can be ensured. In this study, we proposed a three-tier security model for WBN systems suitable for e-health applications and releases on the use of lightweight cryptography to provide security services in the entire data cycle. As a proof of concept, a prototype was developed based on the three-layer model to determine the performance of the proposed method in terms of execution time, memory, and energy consumption. We first provided extensive experimental evaluations to determine the most appropriate cipher suits to ensure specific security services in a real WBN deployment. Conversely, we observed that the cost of crypto algorithms in terms of computational resources is acceptable. And finally, these are the references I have taken. Thank you.